Now let's go back to one of our top stories this afternoon. COVID-19 cases in South Africa have risen to over 9,000 for a second successive day. 9,253 new infections were reported in the latest 24-hour reporting cycle. The positivity rate has risen to over 26%. 34 new deaths have also been reported, with 7 of them occurring during the latest reporting cycle. That takes the death toll to 100,505. Now, let's discuss this. We're now joined via Zoom by Professor Refilwe Phaswana-Mafuya, a professor of epidemiology and public health in the Faculty of Health Sciences at the University of Johannesburg. Prof, welcome again. I hope you can hear me this time.
Yes, thank you very much for having me. And I need also to mention that I'm the director of the Pan-African Center for Epidemics Research at the South African Medical Research Council /UJ collaboration.
All right, fantastic. Now, Prof, South Africa is seeing a big jump in COVID-19 cases. Are we officially in a fifth wave?
It looks like it. If numbers are something to go by in terms of the new cases, we seem to be in the fifth wave.
Now, one of the things that we've always been warned by is that positivity rate. It's currently sitting at 26%. What does that tell us, considering, we've always been hearing that the 5% is actually the mark you want to be at to show as a country that you are actually making headway in the fight against COVID-19?
Look, the testing, the positivity rate has to do with the testing that is being conducted, and it is important to underscore the fact that this can be a function of a number of factors. For example, efficiencies in testing can lead to higher positivity rate, and this can actually mean that the government has a functional testing strategy that captures people who are vulnerable. As you know, we do not test for COVID-19 across the population. We test those who are symptomatic, those who are going to hospitals or who are sick in some way, and we suspect they could be suffering from COVID-19. So positivity rate alone, I interpret it positively, that to have a good yield means our testing strategy is effective in detecting those who are COVID-19 positive. It's not about the overall population, and as a result, we cannot conclusively say higher positivity rate means much more people across the country who are COVID-19 positive.
Now, Prof, we understand that the majority of these new cases are coming specifically from 2 provinces, Gauteng and KwaZulu-Natal, where those numbers are a little bit concerning. But what is of concern is also the hospital admissions have risen. Just not too long ago, 135 being the admissions that have been taken in at hospitals. What can you read into these numbers, and also, is it possible that the fifth wave will be the least onerous so far, but what also does it mean for these hospitalizations?
Thank you very much. I think we need to take into consideration a number of factors. One, the transition, weather transition, seasonality, and look at what has happened in 2020 and 2019 around the same period. What are the trends and patterns? And one can safely say, the transitioning into the winter season itself can, and certain comorbid conditions and influenza and so on can really make the situation to look like it's getting out of hand. I would imagine that the fifth wave, given what we know, we are 2 years into the epidemic, we have systems, we have processes, we've got tools, we've got vaccination, mass vaccination programs going on. I wouldn't anticipate, given where we are at now, that this would be be onerous. The fifth wave would be more onerous. I'd expect that through the tools we have, we can mitigate, the magnitude and even further impacts, especially taking into consideration heterogeneities of risk, some targeted interventions, making sure that those who need vaccination the most are getting it, boosting our vaccination rates and booster rates, so as to ensure that even if people are hospitalized, they don't get into ICU, and those that get infected and not being hospitalized don't really become severely ill. They experience milder symptoms.
Prof, I'd like you to help us unpack why, what is driving this fifth wave. We understand that the BA4 and the BA5 are still classified as lineages of the Omicron variant. What happens if they become dominant? Are they at all to blame for these increases in numbers that we are seeing, or in fact the fifth wave itself?
Yeah, it is difficult to become definite about how the virus will behave. As we have seen in the past 2 years, the virus has behaved differently, but we can also say Omicron has been diversifying itself, and we've seen a rapid development of subvariants, but one is comforted without necessarily being complacent about this by the fact that what we have seen in terms of Omicron and its subvariants, it may be highly infectious, but we've not seen much evidence around disease severity. So we just need to be vigilant and to ensure that the evidence-based interventions as we know them, we adhere to them as much as possible.
Prof, there's also that question of vaccination. You've just recently mentioned it. There are concerns, though, that the vaccination in this country is happening at a drastically slow pace, particularly for those that are over the age of 50. And currently now there's a debate around plans to vaccinate children between the ages of 5 and 11 in South Africa. Kids be vaccinated, considering that should kids be vaccinated, considering that last year children under 5 were being admitted with COVID-19 symptoms, in hospitals? What's your take around that?
My take is that as a country, we need to prioritize those who are at higher risk. I wouldn't go for blanket approaches, that just would say under 5s all to be vaccinated and whatnot. I would say we look at a number of factors, host factors, immunological factors, risk factors such as obesity, children who are obese, who have certain comorbid conditions, who are immunocompromised. We might need to think very strategically about some targeted approaches so that we are impactful in our approach. Because if we apply blanket approaches and we just say everyone should be vaccinated at the same time and so on, we might miss those that we really need to vaccinate by yesterday. That is the elderly, that is people with comorbid conditions, including children with comorbid conditions. So I wouldn't say, no, let's not vaccinate children. I mean, vaccines are safe, vaccines are effective, and everyone who needs them must get it. Health is a right for all. But being, streamlining our systems and processes to catch those that we need to.
Prof, thank you so much for. Professor, thank you so much for that. Unfortunately, we have to go to the Eastern Cape now, where we are monitoring proceedings there. That was